So, as a reminder, we are going to start a series of, it's not a technique, but more a position called sideline. And as we discussed, sideline is great technique for clients with pregnancy, obesity, elderly. Sideline is the most comfortable position for sleeping, so it is the easiest to come and resume it and easiest to get up from that position. It's great for those with lower back pain. Lower back pain, for example, this position is the most dangerous one. Why? Because what happened to some people, the lordosis increase, and that can create a sharp spasm at times. Yeah, so be careful. Acute lower back pain, don't treat this way. Yeah. Other people that will benefit from that are people with one side problem. Let's say one side quadratus lumbarum problem. People who benefit from one side shoulder and neck. That's primarily one side. People who need a lot of more mobilization. You will see how easy it is if you're lying on your side to mobilize, rib mobilization, and actually let people feel that they have a side, that they are not flat. And massage really, generally, was treated facing down and facing up. And the side of the body was forgotten. So a lot of, even this technique would be good when you're working on the side of the body. Yeah? Okay. So one more thing before we're starting is how do you get into the position? From facing down position, you ask the client, which side are we working on? This one. So you need to lie on this side, right? Yeah, good. So you're coming to that side, and you're asking them, you're holding the towel, just that, come from here.
That side.
Yeah?
Okay.
And I'll ask you to shuffle down a little bit. Listen to the instructions, shuffle down, and then lie on your side facing me. Yeah, good, good. Now, the first thing that I need to do is put a pillow. Yeah, put a pillow. Now, do you see the problem? What's the problem? I think the pillow is too much. Yeah? So that's what I brought here. Another folded towel. Yeah, let's try that. Which one is more comfortable?
This one's okay.
This one, okay.
She just made that
Shuffle yourself a little bit more down. Good. So you need to take the face cradle, and there is a lot of alteration that you need to do before. It will take you time, but you need to pass these, to do it one at a time to then make it quicker. First of all, when the client is straight, if you start massaging, do you see what happened to them?
Yeah.
They're moving. So you're taking the legs and bend them. So now they're a lot more stable, especially here. They will still move, and that's an inherent issue that we have to look into. Another issue is that the draping. So what you're telling them, you ask them, can you tuck this under? Yeah, good. And then take this shoulder, this arm outside. Yeah, good. So you can do that. In reality, I will have two towels, like the tea towel, you'll do the same thing. Okay? And still more, a lot of people would benefit from a pillow in between the legs. They just feel really comfy. Yeah? So the position for them is very important, and it will take time for you to do it quick. But I really suggest you to do it because the benefit is quite good. More about position. Yeah, I want you to come close. Yeah. Okay. What I would like to see, I like you to imagine a line between the ear and the nose. Yeah, the ears and the nose. And why? Because a lot of the time we do mistakes with the way we use pillows. And that's correct not only in massage, but also in life, yeah? So when the head tilts this way, lift your head, you need to have the pillow perpendicular to, parallel to. So I've changed that so the support for the pillow would be better. And why? Lift your head again, yeah, and then relax, yeah. Now the pillow is parallel to the table, not to her. If I start moving, you see what happened? That the head fall off the pillow, and she would need to use the extensor muscles to bring it back. We try to relax her, she can't relax. So that's why I lift. Good. Do you feel the difference? Mm-hmm. Yeah. It's important to keep the pillow in the right position, really. Okay. Like before, here you have to think about your position. Where can you treat before starting actually treating? So you can come from here, right? And there is a nice way you can work in this position. You can even mobilize the shoulder area. Yeah. And you can do other treatment here. You can come to the opposite side, and that's a fantastic way to work on the neck and the shoulders. Yeah. You can work on all really the upper thoracic spine even. And I'll show you after what I'm doing here, something very, very nice and very beneficial. And you can do a nice stretch here. And then you can start doing even more that mobilization. Yeah. You see the stretch for the pectoralis major here? Yeah. You can work on the rhomboids, even onto the opposite rhomboids. Okay, so this is the second position. Yeah? So again, first position was from here. Second position was from here. Third position, and it's very similar to what we did before, it's from the same side. Here, again, you can do nice mobilization. I'll show you a few ways. The first one is the simplest one. What you're doing is you're holding your two hands, one on each side of the shoulder, but one arm you stabilizing their humerus. Now you're moving your body, and because of that, everything else moves. You can do the opposite side. You can do a nice stretch in here. You can even do that, and with the other hand, start compression or petrissage. And these tend to be the best technique when you combine two techniques together. So this is the simplest version. The more advanced version would be to have their hand kind of attached to your body and then do the same thing. What's the value for this one? It's harder, but you're stabilizing their arm to your body and they move it. It's better for those people who don't want to move. They're just holding their body. They forgot how to relax. So how do you do that? Arm under, 1 point, 2 points of attack, 3 points and 4 points. And then you move your body. You don't start moving you're losing it. You have to attach it to your body and then. Okay. Do you want to try just this one? Position from prone, position them, arrange the pillows, arrange the position. Some of you would feel that suddenly the table is very wide. You might need to ask them to shuffle a little bit closer, and then look for the position. How do you, almost like imagine if I would not be here and these are the position that you do, what are you going to be able to do? And think creative and try to reinvent the wheel. Yeah? Any questions so far?
Could you show us 3 positions from this side?
Above?
Yeah.
This side?
Yeah.
And I tell you how I work. I put myself in here and said, okay, knowing the contour of the body, where I can use my hands in a way that will be the most beneficial for them and for me. So from here, I think, okay, well, let me try the head a little bit. Or here's the erector spinae. Yeah, actually, it feels kind of comfortable. So I do this small movement. Okay, why don't you try this one? Why don't I try this one? It doesn't feel comfortable. So really try. Don't expect a technique. There is only one technique in the world, and that's the appropriate technique. You have to invent it, really. So don't ask, but really focus into, right, this is my client for today, what can I do? And you always never completely wrong, and you're never completely right, because there is always a different way to do it that is slightly better or slightly not so good for that client. Enough talking? Yeah? Cool.